Hey everybody, Dr. Kim Scheuer again from DOKS Lifestyle Medicine, and this is going to be a two-part series where I talk about October's Breast Cancer Awareness Month, and then November Derek will be talking about prostate cancer for Prostate Cancer Awareness Month. So, breast cancer, how is that affected by lifestyle? Well, very much so. 1 in 8 Americans now American women will be expected to have breast cancer in their lifetime. And that has gone up over the years, and it's gone up as lifestyle has changed in America. So there are 4 things that I would highly suggest if you are a woman and want to prevent breast cancer, because that's the best thing, we want to prevent it, is to eat healthfully, which is a plant-based diet. You do not want to eat meats, especially processed meats, even chicken, fish, and dairy has effects on cancer production, especially cancer in the breast. So you want to avoid cheeses, you want to avoid milk. And you want to do that as young as possible, because it takes years and years and years for cancer to develop. So if you have kids, don't switch them from breast milk to regular milk or whole milk or cow's milk or goat's milk or any other animal's milk. You can switch them to soy milk, and contrary to popular belief, soy milk in adolescence actually prevents breast cancer in the future, because soy milk has phytoestrogens, and so the more soy milk or soy products you give girls, the less breast cancer they will have in the future. So that's number 1, is food. Avoid processed foods, trans fats, saturated fats, and any animal products. That will help. Number 2 is move. Exercise has been very much associated with breast cancer. Cancers in general, but specifically breast cancer. People who are inactive and sit a lot have a higher risk of breast cancer, and people who are overweight do. And that's the next thing. You want to keep your weight down, because fat cells produce estrogen, and estrogen causes breast cancer, or is associated with breast cancer, and especially estrogen positive breast cancer. So the more estrogen you have in your body, the more likely you are, the higher your risk of breast cancer recurrence, and death from breast cancer. So please, 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 1, exercise, move. And by moving and exercise, I mean at least 150 minutes a week of pretty intense exercise where you're sweating, or 300 minutes a week of moderate exercise, like what I'm doing here, where I'm able to talk. I'm not really able to sing, but I'm able to talk. And so you want to do that. You want to move often and well. And so just go, if you have a sedentary job, like a sitting job, just going to the gym doesn't necessarily help. You want to, if you have a sedentary job, get up and walk about 10 minutes every couple hours, just to make sure. So that's 2. Number 3, don't smoke. Smoking is very associated with breast cancer and lung cancer and all other cancers. So don't smoke. Don't start smoking. Don't vape. Don't smoke. Tobacco is not good. So if you are smoking now, stop it. If you aren't, never start it. And the 4th thing is alcohol. Try and eliminate or significantly decrease your alcohol. So there's certain groups that say that any alcohol is associated with cancer, and there's certain groups that say that some alcohol is protective, a very moderate amount, like only 4 ounces of red wine a day, and it's only red wine. Other alcohols are not protective for breast cancer. So if you don't drink, don't start drinking, and if you do drink, limit it to 4 ounces of red wine at the most. But know there's still some risk, and there's controversy there. And so those are some of the major things. You do want to avoid also any other carcinogens, like you certainly don't want to, you want to minimize the amount of chemicals you are exposed to, the amount of pesticides, etc. So if you can afford to eat organic, eat organic. Look at the Clean 15, the Dirty Dozen off of websites that tell it about it. And then, but if you have a choice between not eating an apple or only eating inorganic apples, eat your inorganic apples. That it's better to eat the fruit than not to, even, but if you can, do things organic if you can afford it. So those are some things: decreasing your stress level, loving more, moving more, all make a difference. Oh, and then we talked briefly about estrogen, and so you want to minimize your estrogen exposure. There is controversy about postmenopausal hormone replacement therapy, but you have to know your risk factors, and if you want to supplement, there are some suggestions: don't start supplementing till 5 years after menopause, and max of 10 years of hormone replacement, which doesn't really help since the symptoms come at menopause. There are lots of other options to avoid estrogen therapy and progesterone therapy and hormone replacement after menopause. So talk to your doctor about that. There's a great book that I am in the process of reading right now called Breasts and Owner's Manual, The Owner's Manual, and you may want to take a look at that. It's got excellent research and excellent information. Thanks, and have a wonderful, wonderful day. And Derek will be on soon to talk about prostate cancer for November. Oh, I forgot one more thing for everybody who's listening to this. A lot of people think that if my family members didn't have breast cancer, my risk is low. But I wanted to make sure you understand that 80 to 90% of women who get breast cancer have zero, and I mean zero, first-degree relatives of breast cancers. So that means no mothers, no sisters who have breast cancer. So it really is quite important to keep an eye on it and to prevent it before you ever get breast cancer. And all the things that I talked about previously, every single one of them, if you change your lifestyle to improve your life and do better, that decreases your risk of recurrence if you do get breast cancer. So you have a lot of control, and just sending you all a happy and healthy October, and then November when you talk to Derek.